All right, let's review some practice questions that test you on the content within the diseases and illnesses section of ENT. So as always, when we're going through our practice question video, I do want you to pause the video after we initially review the question and answer options. That way you can select whichever answer option you believe to be true on your own accord, and then you can resume the video and we can go over the rationale together. All right, this is a classic multiple choice style question. This is going to test your knowledge of health promotion and maintenance. A 53-year-old female was recently diagnosed with glaucoma. The nurse is developing a teaching plan for the patient. Which instruction should the nurse include in the plan of care? So to avoid overuse of the eyes, decrease the amount of salt in the diet, administer or tell the patient that the eye medications will need to be administered for life, instruct the patient to decrease fluid intake to help control the intraocular pressure, and then also to tell the patient that high intensity workouts should be avoided. So which of these are accurate? So it's important to tell the patient that the administration of eye drops will be lifelong. It's a very critical component in the treatment plan for a patient with glaucoma. Options A, B, and D and E are not accurate instructions. All right, this is a drag and drop style question. This is going to test your knowledge of physiological integrity. The nurse is performing an admission assessment on a 57-year-old patient that presented to the ED with complaints of painless, unilateral visual abnormalities, including flashes of light and increased blurry vision. The patient also reports a sense of a curtain being drawn over the eye. The nurse recognizes that the patient is presenting with blank and prepares the patient for blank. So there is a key symptom here that you need to always recognize, and that is a curtain being drawn over the eye. So what disease process does that tell you? And then based upon that disease process, what does the nurse need to prepare for in regards to the plan of care for that patient? All right, so you need to recognize that curtain being drawn over the eye is retinal detachment. So retinal detachment is evidenced by flashes of light or floaters, which are often caused by bleeding. The patient can also have blurry vision. A sense of a curtain being pulled over the eye is classic for retinal detachment, and there's going to be a painless loss of central and peripheral vision. Once blindness occurs, complete blindness, that means the retina has completely detached. This is an ophthalmic emergency, so you want to prepare this patient for surgery. You want to put the patient on bed rest and cover both eyes to prevent any further detachment. All right, this is a classic multiple choice style question. This is going to test your knowledge of physiological integrity. While conducting an otoscopic assessment on a patient diagnosed with mastoiditis, what particular observation can the nurse anticipate when examining the tympanic membrane? So a patient has mastoiditis. What is their tympanic membrane going to look like? Is it going to be pink colored, pearly colored? Is it going to be transparent and clear? Or is it going to be red, dull, thick, and immobile? All right, so an otoscopic exam in a patient with mastoiditis is going to reveal a red, dull, thick, and immobile tympanic membrane with or without perforation. Also, your postauricular lymph nodes may be very tender and enlarged. The patient may also present with a low-grade fever, malaise, a loss of appetite. They may have some swelling behind the ear and pain with minimal movement of the head. All right, this is our classic multiple response, select all that apply. This is going to test your knowledge of physiological integrity. A young male presents to the emergency department with complaints of unilateral eye pain and double vision with onset times 1 hour ago when he was utilizing a metal grinder to construct a piece of furniture. The patient admits that he was not wearing eye protection at the time of the injury. Based upon the symptoms, the nurse suspects a possible penetrating object. Which of the following actions should the nurse take? Select all that apply. All right, so the nurse should immediately cover the affected eye with a styrofoam cup and then assist the patient in gathering his belongings to prevent the patient from bending over. So with penetrating objects, you never want to remove the object, as the object itself may be holding other ocular structures in place. So you always want to wait for the provider to remove it. You want to instruct the patient not to lay down and do not bend over, as both of those things can cause an increase in intraocular pressure. Also, there should be no MRI. There may be metal. The penetrating object may be metal in nature, and so an MRI would cause that object to move. As I said before, you want to cover the eye with a styrofoam cup, kind of tape it in place until the provider can examine the patient. All right, this is a drop-down style question. This is going to test your knowledge of physiological integrity. A 9-year-old patient presents to the pediatrician's office with complaints of decreased unilateral hearing with a gradual onset over the last 2 months. Upon exam with an otoscope, the nurse notes an erythemic external ear canal with cerumen impaction. The nurse determines that the patient is presenting with blank as evidenced by blank. So, is this 9-year-old patient presenting with presbycusis, conductive hearing loss, sensorineural hearing loss, or otitis externa? And what is the evidence to support your decision? Is there a physical obstruction? Is there damage to the external ear, damage to the inner ear structures, or is there unilateral hearing loss? Okay, so this is testing. It's basic. The question wants you to recognize the difference between conductive hearing loss and sensorineural hearing loss and be able to pick up on those. So this patient is presenting with conductive hearing loss. There's a physical obstruction of cerumen impaction that is causing decreased hearing on that side. Conductive hearing loss can also be caused by a tumor or an inflammatory process. Again, in this case, it's the cerumen impaction. Sensorineural hearing loss is caused by a pathologic process. So this is damage to the inner ear structures or prolonged exposure to loud noises. And then you should know and recognize that presbycusis is a hearing loss that is associated with aging.